So, good morning, everyone. On behalf of Screen NJ and Rutgers Cancer Institute, hello and welcome to Community Cares and Project Echo. Thank you so much for joining today's session, and we hope that the information shared today will help you serve your community better. I have a few announcements before we begin. This is just a quick disclaimer that the information contained in this presentation is not substitute for medical consultation, and a physician should always be consulted for any health problem or medical condition. So today's agenda, we're going to do a Project Echo series overview, introductions, the actual presentation, a case study, and then we'll do questions and answers at the end. So a little bit about Project Echo. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The Echo model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. For more information on Project Echo, you can go to echo.unm.edu. And for our speaker today, we have Dr. Katie Darabos. Dr. Katie Darabos is a social health scientist and instructor in the Department of Health Behavior, Society, and Policy at Rutgers School of Public Health. She is an associate member of Cancer Prevention and Control Research Program at Rutgers Cancer Institute. The primary focus of her research is understanding how social and emotional factors affect health and well-being among young adults with cancer. The emphasis of her work focuses on examining the role of one's social network, partner, family, friends, in facilitating adjustment to cancer. Dr. Darabos' research is funded by the National Cancer Institute, the New Jersey Commission on Cancer Research, the American Institute for Cancer Research, and the Pediatric Hematology and Oncology Research Center of Excellence at Rutgers Cancer Institute. Thank you so much, Dr. Darabos, for being here today and giving this presentation. I will pass it to you.
Great, thank you. The title of my talk today is Navigating Cancer and Young Adulthood, Psychosocial Approaches to Improving Health and Well-Being. Next slide. So I have no conflicts to disclose, except that it is a very busy day on my street today. They're pouring concrete in my neighbor's sidewalk, so if you hear banging and whatever, apologies. Next slide. So I think a poll should be popped up for this pre-quiz.
Almost there, maybe another minute or less than. I like to get it up to 75%. We're currently at 58%. So if you're doing the poll, that would be great. All right, let's go ahead.
Great. So for today, I thought I'd give just a little bit of background on young adults with cancer, talk a little bit about social support, and then jump into cancer-related decision making, talking about some work that we've done on daily decisions and biological stress. I'll do a brief case presentation and then talk about some implications and discussion. Next slide. So I thought just to give a little bit about myself. So I am born and raised in New Jersey. I got my bachelor's in psychology from Montclair State University. I have my master's in experimental psychology from Seton Hall University. I took some time off before I got my PhD and worked at the Rutgers Cancer Institute as a research assistant for a couple years. I have my PhD in health psychology and clinical science, where I really kind of honed in my interest on young adults with cancer. I did my postdoctoral fellowship in behavioral oncology at CHOP at the Children's Hospital of Philadelphia. And my current position is in the School of Public Health, where I'm an instructor of public health in the Department of Health Behavior, Society, and Policy. So I wanted to kind of ground this talk with some quotes from a young adult cancer survivor. So you might be familiar with Salika Jawad. In 2011, she was diagnosed with an aggressive form of leukemia at the age of 22. She's currently 37. At that time, she was given a 35% chance of survival. She was in treatment for 3.5 years. She's had chemotherapy. She's been on clinical trial. She had a bone marrow transplant. Her cancer returned in 2021, where she underwent a second bone marrow transplant. And most recently, a couple years ago, her cancer has since returned again, where she is now undergoing ongoing indefinite treatment. She will never be cured from her leukemia at this point. She was a column writer for the New York Times for Life Interrupted in their kind of health section. So every week she would write a column about her experiences of being a young adult and being diagnosed with cancer. At the time when she was diagnosed in 2011, she had graduated college. She was in Paris. She was a reporter with dreams of being a war reporter, and then since then needed to come back home and start treatment, which is kind of a common thing we see for young adults who are kind of out in the world and then need to halt what they're doing and come back. She has a documentary with her partner John Baptiste called American Symphony, where he's kind of developing the symphony, but it does kind of chronicle a little bit of her experience. And she's a published author. She's written a book called Between Two Kingdoms about her experience with cancer, the Book of Alchemy. She's also an advocate for young adults with cancer and a motivational speaker. So I'm going to be using quotes from her throughout the talk to kind of ground the young adult experience. So this is the first quote here. So it started with a mysterious edge that blossomed into all kinds of symptoms, and ultimately, almost exactly a year after I graduated, I was diagnosed with an aggressive form of leukemia. And it was one of those bifurcating moments where your life fractures. There's a before and there's an after. And even though I didn't know much about my diagnosis or what treatment would look like, I understood that I would never be the same. So when we think about young adults with cancer, more than 80,000 young adults between the ages of 18 and 39 are diagnosed with cancer each year in the United States, with about 9,000 deaths occurring annually. Cancer is the top five leading cause of death among young adults in this age group, behind suicide, homicide, accidents, and most recently COVID had kind of entered that top five. When we think about young adults with cancer, they will spend majority of their lives as cancer survivors. Here I'm using the term from the National Cancer Institute for survivor, which defines which defines somebody as a survivor from the time of diagnosis. So that's what I'm going to be referring to as cancer survivors. When we think about young adults with cancer, they have physical, social, and emotional needs that not only differ from their age-matched peers, but also differ from the needs of our younger pediatric patients and our older cancer survivors. Next slide. So when we think about young adults with cancer, this is a figure from Berkman, which really talks about this impact of cancer diagnosis and treatment and these social drivers of health. So we see impaired achievement of developmental milestones, specifically in the areas of education, dating and intimacy, careers, financial independence, partnership, family building. We see that cancer and cancer treatment puts young adults at increased risk for chronic health conditions, for subsequent cancers later on, for poor psychosocial health, for financial instability, and for early mortality. And all of these kind of drivers here can be kind of modified by demographics, socioeconomic status, health behaviors, genetic predisposition. So this kind of gives a picture of what is impaired in the developmental life trajectory of young adults when they do get diagnosed with cancer. So my work kind of focuses on social support, stress, and coping. So in terms of social support broadly, not just among those with cancer, but in everybody, we do see robust relationships in which social support is protective for our health. Specifically, when we think about young adults with cancer, higher levels of social support is associated with lower depressive symptoms, stress, and severe grief, with better psychological and existential quality of life, with lower sexual dysfunction, and with greater decisional satisfaction. But what we see for young adults is that social support can be really challenging for young adults with cancer. A lot of their social networks, family members, friends do not know how to provide support to somebody as young as a young adult undergoing cancer. This quote from Salika here says, I think another aspect of being a young adult with cancer is that most of your friends, hopefully, have never had to experience life-threatening illnesses themselves. So a lot of my friends had no idea how to respond and found it really difficult not just to find the right words, but sometimes to find any words at all. And so we've done some work looking at this, trying to understand what types of support-related behaviors young adults preference when they're engaged in cancer-related conversations with their friends or family members. And so we asked young adults here, what would you find to be the most helpful for you when engaged in a cancer-related conversation, and what would you find to be the least helpful for you? So, in terms of most helpful, young adults really kind of preference listening. They preference empathy, validation, and encouragement, and really having an honest conversation. So, this one young adult says, I find it most helpful when my social network listens. They do not need to provide advice. Just speaking my fears, anxieties out loud to somebody is very helpful for me. Not surprisingly, some least helpful things that we found were minimizing, showing pity or worry, networks being uninterested or changing the subject, providing intrusive comments or questions, and then providing some negative stories or comparisons. This one young adult says changing the subject definitely is jarring. Glossing over what I'm saying is difficult to then tell me, but you're doing so well, or but you look so good. And so when we put this all together, we really get to see that young adults often feel that their social networks do not know how to provide effective support. And that's no fault of the social networks. Social networks are often inexperienced as cancer support providers, especially in this kind of 18 to 39 age range. We're hoping some of these results can provide some guidance on how we can help support networks to provide the support that young adults preference, which is associated with well-being. And it may reduce uncertainty and distress associated with this kind of intense support provision that is needed at an unexpected time. When we think about support, it's not just kind of concentrated among family member and friends. We also see that support can be attained through relationships with oncology providers. So when we think about young adults with cancer, they have to navigate complex medical information. They have to make difficult medical decisions. They're often coping with a lot of medical uncertainty. And this can lead to disruptions in kind of meaning and peace of mind. So it's really kind of important to consider how relationships with oncology providers or those within this kind of health network may foster meaning and peace, which is important for well-being. And so when we think about this, we've done some research using this human connection scale. So high quality communication and information from providers is often associated with greater meaning and peace of mind, but we need to assess more than communication. So the human connection scale really kind of focuses on relational connection. So it's asking individuals, to what extent do you feel understood, cared for, or have a sense of trust with your doctor or your oncology provider? And so we administered this scale to young adults with cancer, and we found on the whole that young adults that felt more connected to, had a better sense of connection with their oncology providers, was associated with greater meaning and peace. But we wanted to see, are there specific items that kind of pop in this relationship? So these are in the second box in blue. So to what extent does your doctor pay close attention to what you're saying? How much do you respect your oncologist? How often do you understand their explanations? How often does your oncologist offer hope? And then how concerned is your oncologist about your quality of life? So we found that those items were significantly associated with meaning and peace of mind. And we think this is really important. It really calls upon this opportunity for patient-provider connection to help young adults kind of cope with and understand their illness, which is really important. We've done some work recently to kind of just understand how young adults are perceiving their illness. And on the whole, it seems like young adults feel like cancer has severely affected their life. They're extremely emotionally affected by cancer, and they're extremely concerned about their cancer. We also did some work asking, here this is adolescents and young adults, what do you think caused your cancer? And this is the box on the right-hand side, so these causal attributions. And a lot of adolescents and young adults say things are causing their cancer, which might not be the actual root cause. So things such as bad luck, personal stress, too much sickness, exposure to chemicals, the devil, sun exposure, not using the bathroom. So we really do feel like, having this kind of sense of connections with providers might help young adults to really kind of understand their cancer a little bit better, which may help facilitate decision making. So with that, I wanted to kind of jump into cancer-related decision making. And I'll start with a quote from Salika that says, "The cruel irony of medicine, sometimes the treatments you receive to get better make you worse in the long run, requiring further care, exposing you to yet more complications and side effects. It's a maddening cycle." So when we think about decision making among young adults with cancer, they're faced with making these significant cognitively and emotionally related cancer-related decisions. Oftentimes, when we think about cancer-related decision making, the most often decisions that come to mind are these treatment-related decisions, but there are a whole host of other decisions that young adults are making as well. So there is this enrollment in clinical trials if they're offered a clinical trial, but they're also managing their pain, they're managing fatigue, they're dealing with fertility and family planning decisions. With goal pursuit, do I take a leave of absence from my job? Do I stop working? Thinking about illness disclosure, who am I going to tell that I have cancer to? Do I tell my friends? What does that kind of look like for me? And then for those that have kind of metastatic or advanced disease, thinking about these kind of end of life discussions or advanced care planning. And so engagement in cancer-related decision-making often leads to distress. This may result in a struggle to really kind of fully understand or grasp information that is needed to make these cancer-related decisions. When we think about decision-making, support members, so family members, a partner, friends, and medical providers can really play a role in helping young adults cope and navigate cancer-related decision-making. And so a lot of these decision-making models tend to focus a lot on these cognitive aspects of decision making, so weighing the pros and cons, which makes sense. But I really do like this model. This is a cognitive and emotional decision-making framework model that takes into effect both the cognitive side of the decision as well as the emotional side as well. So I'm just going to walk through kind of what this model is. So next slide. So in stage one, we're kind of focusing on these practical cognitive and affective elements of the health threat. So stage one is like, you have cancer. Let's talk about what are the cognitions that you have about this. This could be the seriousness of the cancer. How are you emotionally affected by this? This can be thinking about fear of cancer recurrence. And then we move on to stage two. And this is where we're focusing on the cognitive and emotional aspects of the health-related decision that you're making. So this can be weighing the pros and cons of the decision, and it could be kind of navigating this potential distress of trying to make a decision between two choices that you're provided with. And then we have all this feeding into these coping targets here. So the goal of this kind of cognitive system, this top system, is to kind of maintain balance through engaging in problem-focused coping. So here you're thinking about planning, you're thinking about seeking information out, weighing these pros and cons, maybe going and doing some research yourself. And then the goal of the emotional system is really to manage these emotions through engagement and emotion-focused coping. So this can be venting, this can be talking to your social support network, this can be humor. So whatever kind of emotional target you have, journaling. Um, Next slide. And then all of those kind of feed into this health behavior. So, what this looks like if we're thinking about a young adult with cancer, this could be delays to making a health related decision resulting from potentially depleted coping processes due to distress and fear over the cancer diagnosis, and then stress of having to make an important, potentially life altering decision. So, when we think about decision making among young adults with cancer, it's really important to kind of think about, okay, they're having some feelings and emotions associated with the cancer itself. And on top of that, having feelings and emotions associated with making this decision. And how do those all interact to actually kind of come to a decision at the end? And so we did some work to try to understand kind of what are these kind of cognitive and affective processes associated with decision making. So here we had adolescents and young adults and their caregivers and oncology providers just tell us a little bit about decision making. And so we asked them to identify or pick a cancer-related decision that they felt comfortable talking about. A lot of them collapsed on a treatment-related decision, but we did have some supportive care-related decisions, so nausea, school-related, nutrition, fertility, pain. And we talked a little bit about decisional involvement. So there were a couple of different ways that young adults felt that they were involved in their decision. Some young adults felt that it was a collaborative process. This top quote saying, I talked about it with my family and we kind of made a decision, all the four of us together. Um, some kind of parents talked about like, I need to take a step back and let my child here make this decision, learn from them, learn when I can step in and say something, but ultimately it's kind of their decision to make. And then oncology providers really kind of talked about it depends on the day. Sometimes young adults felt more engaged, sometimes they didn't feel more engaged, sometimes they wanted whoever was with them there to make that decision. So this kind of gives you a sense of kind of how and who are making these decisions for young adults. And then we looked a little bit at these kind of cognitive and affective processes and these coping strategies. Next slide. And so, in terms of the cognitives, we found, knowledge and weighing pros of cons. This young adult survivor here talks about getting an NG tube and this is she here, whether she wanted the NG tube put in to kind of manage her nutrition or whether she felt that she can to kind of take the reins. And ultimately, she decided that she would rather force herself to eat and drink than have the tube. So that was a decision that she was kind of grappling with. There's emotional processes, so some sadness that there's a lot of physical complications later on, like infertility. There's a lot of why me, being overwhelmed with all these different options. And then coping. So a lot of young adults talked about distracting themselves, going for walks. This young adult male talked about going fishing. So some of these kind of coping targets that they're using to kind of reduce distress in decision making. So I've been talking a lot about distress and stress. So when we think about making decisions, we did do some work looking at how this kind of manifests in the body. So when we talk about decisional uncertainty, that can play a role in decision making. This is feeling uncertain, feeling uninformed, feeling unsupported. So given the stress and uncertainty, this kind of, stress associated with decisions may result in activation of physiological stress systems. So I'll talk a bit about some of the work that we've done in that area. And so I'll present another model. This is the biopsychosocial model of challenge and threat that says that we have this stressor. This could be cancer. This could be the health-related decision that young adults are making. And that there's kind of two processes that happen when we have this stressor. So we can have a challenge appraisal where you're approaching a stressful situation as a challenge. And this is kind of beneficial because the coping resources that you have exceeds the challenge demand, so you're able to cope with the actual stressor. Or we have the flip side of this where young adults can approach a stressful situation as a threat, where the demands exceed the coping resources. So I just don't have any resources to cope with this decision right now, and that can be harmful. So that's on the psychological side. On the physiological, oh, can you go one more? I think I Oh, I'll just talk through the physiological side. So through the physiological side, we can have this kind of challenging our physiological resources here, which is kind of like an approach activation, which is kind of beneficial. This results in lower kind of physiological output, or we can have these kind of threatening physiological responses where this kind of looks like a threat, and we need to kind of mount more of our physiological responses to kind of manage this threat. And at the end, this can really kind of relate to enhanced or impaired cognitive functioning in terms of decision making. Next slide. And so, to kind of understand this decisional uncertainty and physiological dysregulation, we did some work here. This was with adolescents and young adults, where we administered saliva samples 3 times a day for 2 days. So, they're basically given this tube you see here. It's called a cryovial. And we're asking them to passively drool in this tube once they wake up, 30 minutes after awakening, and then in the evening across 2 days to give us a kind of diurnal profile of physiological responding. Here we're assessing for cortisol, and then we ask them to tell us a little bit about the decisions that they were making for 7 days. And so, just to give a little primer on cortisol, typically what happens is you wake up in the morning and you kind of have these baseline cortisol levels. Within 30 minutes after awakening, those levels tend to peak, and then throughout the day they tend to decline. This peak from awakening to 30 minutes or 45 minutes after awakening is called the CAR. It's called the cortisol awakening response. Next slide. And what we're looking for in these kind of cortisol levels is to see, is there kind of a normal cortisol awakening response? So are we kind of seeing that peak and decline throughout the day? And so on one of these figures, you can see there's a normal cortisol response. The blue bars are these kind of elevated cortisol response. We have these kind of quick peaks. And then we can also have some times where we have a peak and then the levels really don't kind of return back to baseline. So that's that orange line on the second figure. And depending on kind of what these curves look like, it can be associated with kind of elevated distress or this kind of wear and tear within the body. Next slide. And so, thinking about these morning and evening decisions that young adults here were making, decisions kind of made, and when we asked them in the evening, what decisions did you make, really kind of reflected the decisions that they said they were going to be making in the morning. So, in the morning, we just asked them kind of open-endedly, what do you plan on making a decision today about? And they matched the decisions they're making in the evening, which suggests here that young adults really have a sense of what decisions that they're going to be making upon awakening, which kind of gives us an insight into how we might be able to better help young adults kind of at the get in the morning. We also looked at this decisional uncertainty and cortisol. So we asked young adults, how informed, how supported, and how uncertain do you feel in your decision making? Next slide. And we found that this dysregulated cortisol pattern in this high decisional conflict group. So those that felt uninformed, unsupported, and uncertain in making their decisions, we kind of see this kind of dysregulated cortisol pattern. You can see it's this kind of black bar that we're not really seeing that kind of peak 30 minutes after awakening. We're seeing kind of levels, and they are dipping throughout the day, but there is no cortisol awaiting the response, which potentially suggests that this conflict and uncertainty in making decisions may be impacting stress systems among young adults with cancer. And so I thought, that would just give a kind of a little bit of an overview about cancer-related decision making, what decisions young adults are making, how it impacts them both psychologically and physiologically. And so I thought I'd really kind of jump in now to a cancer-related decision making case example. And when I was thinking about putting this case together, I had just come back from a conference last week where the resounding theme was, if you've seen one young adult patient, you've seen one young adult patient. Um, so I thought I'd present a couple of cases um, to kind of give a sense of not every young adult is the same. They might have the same kind of underlying cancer diagnosis, but they're going to be grappling with multiple different decisions. Next slide. And so I'll present 3 different cancer patients, and then I'll talk a little bit about kind of what does this mean for decision making. So Jordan is a 27-year-old grad student recently diagnosed with Hodgkin's lymphoma after experiencing fatigue, swollen lymph nodes, and unexplained weight loss. Jordan lives independently, engaged to be married, and hopes to have children in the future. This is Jordan's first major health crisis. In terms of decision making, Jordan's oncologist recommends beginning with chemotherapy within 2 weeks. This treatment has a high success rate, but it may affect fertility. So Jordan must decide between whether to begin treatment immediately or delay treatment briefly to pursue fertility preservation, so egg freezing, depending on the context. So when we're thinking about factors that are influencing this decision making, we can think about the emotional response. So Jordan feels shock, fear, and anxiety after hearing this diagnosis at 27 years old. These emotions make it really difficult to process this medical information and make these quick decisions. We could talk about developmental stage. So, as a young adult, Jordan here is really focused on career goals, relationships, future family planning, and cancer is interrupting these life milestones. There's family and social support. So, Jordan's parents want treatment to start right away, whereas Jordan's fiance encourages exploring fertility options first. These differing opinions here really kind of create stress. There's financial concerns. There's worry about the cost of treatment, worry about delays to work, missed work, and will fertility preservation even be covered under insurance? And then health literacy and communication. So Jordan has trouble understanding medical terminology, the treatment risks, and it makes it harder to feel confident in this decision. Next slide. This is Marcus. Marcus is a 36-year-old married father of two. His children are at ages 6 and 9. He works full-time in construction and is the primary financial provider for his family. He's diagnosed with non-Hodgkin's lymphoma after experiencing persistent fatigue and swollen lymph nodes. In terms of decision making, his oncology team recommends starting aggressive chemotherapy immediately. It will require him to stop working for several months and may cause long-term fatigue. Marcus must decide whether to begin treatment right away, to consider less aggressive options, and how to manage financial and family responsibilities during care. Factors that influence his decision making is this provider role pressure. So Marcus identifies as the family's financial provider. Not working creates feelings of anxiety and failure, influencing hesitation about starting treatment. Establish responsibilities. So, unlike kind of our younger individuals diagnosed with cancer and our older ones, Marcus supports a household. He supports a mortgage. He has children's needs. His treatment disrupts the stable life structure that he's worked years to build. Masculinity and help seeking. So, Marcus struggles as a man with accepting help from others. He views his dependence as weakness. It may make it harder for him to accept financial assistance and support. There's parenting concerns, so worry about being physically unavailable for his kids, fears about how his kids will perceive his illness, financial stress with the loss of income, mounting medical bills, uncertainty about returning to work, and then marital strain. His spouse encourages immediate treatment and seeking help, but Marcus feels pressure to push through and try to keep working as long as possible. Next slide. And then lastly, we have Ethan. So Ethan is a 34-year-old married man with a 2-year-old child and another baby on the way. He works in a competitive corporate job with limited medical leave benefits. He's diagnosed with acute myeloid leukemia after going to the emergency room with severe fatigue and frequent infections. Unlike more straightforward cases, Ethan faces a cascade of urgent decisions that must be made quickly, often under stress with incomplete information. So, thinking about these factors influencing his decision making, he thinks about a second opinion. The recommendation is to start treatment within days, although Ethan wonders if he should delay seeking treatment and seek a second opinion at a larger cancer center. There's treatment intensity, so he must choose between starting chemotherapy immediately or having chemo followed by a stem cell transplant, which has higher risks but can improve long-term survival. Fertility preservation, his treatment could cause infertility, so him and his partner must decide whether to delay treatment for sperm banking while balancing this urgency of starting treatment immediately. Clinical trial participation, he was offered enrollment in a clinical trial testing a new therapy, but this is leading to uncertainty about outcomes of that versus potential benefit. Financial planning, Ethan and his spouse must have to decide how to manage reduced income, medical bills, childcare costs, and insurance complexities. Care location, so they have to decide between local care at a cancer center within their area for convenience or traveling to a specialized cancer center with more resources, but that would provide greater disruptions to his life. Family communication, he's really struggling with how to share this information with his young child and then how to prepare for the arrival of a newborn during treatment. And then advanced care planning. So, given the seriousness of his diagnosis, he's encouraged to consider advanced directives, which is emotionally difficult at his life stage. Next slide. So, taking all these kind of cases into consideration, we can think about these developmental and psychosocial challenges. So, there are these competing adult roles. So, in all these cases, these young adults are balancing career advancement, parenthood, partnership. There's time pressure, so having to make these decisions more rapidly due to disease progression. There's cognitive overload. Young adults here have to digest a large amount of complex medical information. There's emotional distress, there's fear, uncertainty, anticipatory anxiety, premature mortality, these kind of late effects of cancer treatment. So, having treatment at 20, 30 years old, chemotoxicity, what does that mean down the line? There's an increased risk for secondary cancers, there's increased fatigue. So what does that mean to have all of this treatment now? And when we think about young adults with cancer, about 80% of them are surviving, over 80% are surviving at least 5 years past their diagnosis. So we can see young adults living 50 to 60 years past their diagnosis. So what does that mean for this treatment that they're receiving now and quality of life in the future? Then there's this responsibility to others. So decisions really kind of affect partners and spouses, children, other family members, and really kind of affects their financial stability. And so there are some intervention and support strategies that we can think about when we think about the oncology providers and the oncology care team. The care team can help create short-term achievable goals during treatment that may be really helpful for young adults who are kind of focused on what this may look like long term. We might be able to say like, hey, what are your short-term goals now? What do you want to do? How can we help you kind of achieve that right now? Which may create kind of a sense of autonomy in kind of an unpredictable world. Um, the healthcare team can clearly explain the risks of delaying treatment and the benefits of early intervention. Providers can also normalize that many young adults experience these interrupted milestones during treatment. I will say that a lot of the young adults that we enroll into our studies feel very alone. They feel like they're at a cancer center with a lot of older adults with cancer and they can't find themselves in this system. So I think normalizing saying this is something that a lot of young adults are going through is really helpful. When we think about mental health professionals, social workers, or child life workers, they can really help process this grief related to these delayed goals, encouraging young adults to delegate responsibilities and preserve energy. Like, you don't need to be doing all of this right now. How can we help you offload X, Y, and Z? A social worker can also aid with employment resources and family planning and navigating insurance. How do we have these conversations with insurance companies? Family meetings can really balance parental support and autonomy, including partners and spouses as decision partners. And then child life and family support services can help explain illness to children in age-appropriate ways. Oftentimes, I feel like, anyone with cancer, specifically young adults with cancer, want to take on everything kind of at once. But you might not have the words for what this means, especially talking to children. So involving child life workers who do this on the regular is really, really helpful and beneficial. And then other support outlets. So friends and relatives can help organize meals, rides, childcare assistance. One of our young adults in our study said that she created a chemo registry that was kind of, akin to a baby registry or a wedding registry where she put things on there that she might need, whether that's fuzzy socks for the hospital or a robe or something like that. And she sent that out to her family and friends, and that was kind of a way for them to support her and really her not having to put a lot out there. There's also young adult cancer support groups or social media outlets to connect with peers that are facing kind of similar challenges. Next slide. And so these are fictitious cases, but I did not want to be leave everybody hanging and not provide some outcomes. So in terms of Jordan, so after meeting with specialists and discussing priorities, Jordan chooses to complete fertility preservation quickly and begin chemotherapy. Jordan reports feeling more in control and less anxious after receiving support and having time to consider options. Marcus, after discussing with his care team and family, chooses to begin treatment promptly and applies for short-term disability. Accepting help from extended family allows him to focus on recovery. Over time, he reframes his role from the sole provider to an active participant in family resilience. And then in terms of Ethan, he chooses to begin treatment quickly. He completes rapid fertility preservation. He enrolls in a clinical trial. He opts for care at a specialized center despite the inconvenience as he's prioritizing long-term outcomes. And with structured support, he reports feeling more confident despite the complexity of his decisions. So the cases have really highlighted how decision making is shaped not only by medical needs, but also by emotional distress, by identity development, by relationships, by responsibility for dependence, by finances, by thinking about the future. So a whole host of stuff goes into the decision making. Young adult cancer patients face not only just one major decision, but a series of overlapping high stakes decisions. So there might be this overarching decision, but within that decision, there are multiple decisions kind of layered under that. Decision making can be a dynamic, ongoing process shaped by urgency or uncertainty, multiple life roles, requiring this kind of coordinated, multiple disciplinary support. Cancer challenges not only the physical health, but also deeply held beliefs about independence and strength and what does it mean to be successful in adulthood. And then support networks and care teams can play a supportive role in facilitating this decision making and well-being. And so I thought I'd end with a quote from Salika, and I'm going to provide two because I think it gives kind of a shift in perspective. So this first quote was in 2015, a couple of years after she was diagnosed. So the goal had been to get rid of cancer, but now that I was done with the cut, poison, burn part of the disease, I sat dazed and alone in the rubble, unsure how to move on. I hadn't noticed the fine print until now. When you survive something that was thought to be unsurvivable, the obvious is gained. You have your life, you have time, but it's only when you get there that you realize your survival has come at a cost. And then I wanted to provide a quote that she gave last year, and I think this is really interesting. This is a 15, there's like a 10-year difference in quotes here. And so she says, instead of focusing on surviving, I'm very much making it my priority to focus on living. And while an illness is part of my life, it's not the central focus of my life. I've had to adapt to a gentler mindset of living every day as if it's my first, on focusing on the small joys, on the things that fill me with a sense of curiosity and wonder, and to greet the day like a little kid might. So I think it's an interesting, not a shift in perspective, but kind of thinking about Salika at the time of diagnosis and now her reflecting almost 10 years later after diagnosis and what her kind of cancer journey looks like for her now. And so I hope I've given some information about how we kind of support and informate and enhance the well-being of young adults with a focus on decision making. And with that, next slide. I'd just like to acknowledge collaborators that I have both at Rutgers and outside of Rutgers, and the funding for the work that I talked about today. And thanks for your time.
Thank you so much, Dr. Darvos. That was amazing. I really love how you really went into all of the factors. We can take some questions now. I will stop sharing my screen and we can answer any questions people have in the chat. Feel free to unmute too if you have a question. I had a question actually, I'll go first then. Um, I wanted to ask about the process of you curating and developing the questions that you asked the young adults. Like, how did you come up with those questions? What was your team conversations? Like, how did that look like?
Yeah, that's a great question. I think a lot of this work, when we think about support and decision making, a lot of the questions really kind of focus like on the whole, like how satisfied are you with the support that you receive from your social networks? And so thinking about that, it kind of doesn't really run the gamut of who is in your network and who is supporting you. And so a lot of this work is qualitative work. And I love qualitative work because it gives you kind of a deep sense of the individual and of their network. So we're really kind of taking these who supports you questions and then asking them in kind of a qualitative kind of fashion. So what type of support do you want? What type of decisions are you making? And really leaving that up to the young adult themselves because we want them to feel comfortable and okay with talking about their experience. Specifically when we were doing the decision making work, we didn't want to start with, hey, can you tell us about your treatment related decision? Or can you tell us about how you manage pain? Or can you tell us about how you manage fatigue? And kind of leaving it up to them, what is the most salient decision that they've had to make, so they can kind of talk about their process, just to kind of make it a little bit more comfortable and inviting for them. Because a lot of these decisions are very personal decisions. And so I think when we approach this type of research, we try to approach it in kind of a semi-structured way. So we have these questions and ideas that we're interested in, but we're also letting the young adult kind of guide that conversation as well.
Thank you. Did anybody else have any questions? You can put them in the chat. You can unmute.
I have a question on the mental health and mental health support. So is there any recommendations for long-term mental health support?
Yeah, that's a great question. It's interesting. We're doing some work right now focused on, excuse me, young adult couples with cancer, and I think one of the concerns that they come back and talk to us about is I was diagnosed with cancer and I'm given this folder, and inside this folder it's stuff about how do I retire and how am I doing this and how am I doing this? I'm not there yet. So they really want these resources that are targeted to them right now. And so there are a lot of organizations out there that provide this kind of targeted support. Thinking about kind of the long-term resources. I think that's really dependent on kind of where young adults are, kind of in their stage. I know a lot of young adults are turning to social media to try to, one, put their story out there because they feel like such an anomaly for being diagnosed at such a young age. So, in part, it's kind of this altruistic, like, I'm going to go out there and put my story on Facebook, or I'm going to put it here so if I can help somebody else recognize these symptoms. Two, it's just feeling alone. So a lot of young adults have turned to Reddit and find those message boards where they can find other like young adults. And that's something that can kind of expand kind of across the lifespan as young adults are moving further into survivorship. There are also young adult organizations where some of them like will send like a Lego kit in the mail, and you get the Lego kit and then you come to a Zoom and it's you and other young adult survivors and you're talking about your cancer experience, but you're also building Legos at the same time. So it's kind of this felt connection about, hey, we're not just going to come here and like talk about cancer, but we are going to talk about cancer and we'll build or we'll journal at the same time. So I think it's those things that young adults are really looking for, this kind of felt connection and support, which might kind of change for them kind of over time what that support looks like, whether it's support, family member support, young children in the household. I really want to connect with another young adult who has kids. What's their process like? So I think it's very individual, but also can change over time.
Interesting. I would not have expected Reddit. Like,
Yeah.
I have a
um,
question. Oh, go
yes,
ahead.
of course. Ask.
So my question is the deaf community, how do they relate and who do they have to depend on? As well as the blind community.
Mhm.
I know that if you know, regular teenagers, they have somebody to see, hear, and understand. But how do they relate to this knowing they have cancer and have so much else going on in their life? How do they, cope with it? Have you came across any? That's my question.
Yeah, that's a great question. I will start by saying I have not, we have not enrolled any deaf or blind individuals into our studies, and I feel like when we think about cancer disparities and the type of research that we have among the young adult population, it is a very upper middle class, non-Hispanic, white driven research area. And so, unfortunately, I don't have any work that has worked with kind of the deaf or blind community, and I haven't really kind of come across any papers in that area. There might be some research out there, um, but I feel like there is a little bit of a big movement now towards cancer disparities and towards enrolling those of different racial and ethnic groups into research so we can get the fuller picture of this experience among individuals. And so, unfortunately, I don't have an answer for you right now, but I would imagine that that's another added layer of distress and how do we reach those populations and if anybody has any kind of resources to how we can reach these populations, I would be grateful, or maybe we can share it with one another, so that we can get a more kind of representative sample of young adults diagnosed with cancer.
Yeah, that would be an interesting population. I mean, there are organizations that work specifically with those groups, so that might be um contacting them. Like I know when I was still working in corporate in a past life, I used to volunteer at the Lighthouse, and that was
Mm.
an organization for the blind and visually impaired. So that might be going through organizations like that. Does
Thank
anyone
you,
else have any
Joyce.
questions?
Feel free to unmute or in the chat. I'm also going to be posting this to Mighty Network, so if you come up with a question later, you can always ask there, and I'll send it to Dr. Darrows. Thank you, Joyce, for your question. We can go back to the slides now. Okay, so now I think we have the post test, so we can go ahead and launch that.
Just need a little bit more time. We need this is when we need our Jeopardy music.
I know.
Just trying to get a good threshold percentage. Just a few more people can do it. That would be great. Okay, we'll leave it open for about another 10 to 15 seconds. Okay, I'm gonna go ahead and end it and share the results.
Dr. Darrows, do you want to go over these or?
Sure. Yeah, so more than 80,000 young adults aged 18 to 39 are diagnosed with cancer each year. That is true. Cancer is one of the top five leading causes of death among young adults in this age group. That is also true. And support members and/or medical providers can play a role in helping young adults cope and navigate with cancer-related decision making. That is true as well. So if you just did true, 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 you got it all right.
And they did. We got 100%
There you
on all
go.
three questions. Fantastic, group.
I have a few quick announcements to close out with. NJ Seed, that phone number and the link will be in the chat. It's free screenings for breast, cervical, colorectal, and prostate cancer all across New Jersey. And thank you so much for attending today's session. The evaluation link will also be in the chat. Please let us know how we did, what you thought of this session. And the Mighty Networks community, everything will be uploaded there, as well as resources that Dr. Darabos would like to share. It will all be there, the recording, the PDF version of the slides will be there as well. Join us next month, May 28th, for a session on the impact of PCPs on survivorship. I believe that is a Thursday instead of a Tuesday as well. And yes, thank you so much. Thank you so much, Dr. Darabos, for this entire presentation. We haven't done something like this, and it was really eye-opening. So we really appreciate you coming here. Thank you.
Thank you for the opportunity. This was great.
Thank you. Thank you, everyone.